My name is Dr. Khilan Shah. I manage the Moorfields Eye Bank based at Moorfields Eye Hospital here in London. I oversee all aspects of eye donation, from the donor and their loved ones through to coming into our special facility here in London, where we store, quality assess and issue those tissues to patients as well as to research. So when someone unfortunately passes away, we can speak to the next of kin of that loved one and offer them the options of eye donation. And if that's something the donor may have wished to do either in life, or that's something their family thinks that the donor would have liked to have happened, we can then perform what we call a patient assessment and a consent with the donor's family, and it's all done over the phone. The patient assessment asks questions regarding the medical, social and behavioural history of the donor. And the consent is just a legal document that, again, we fill out over the phone. The whole process takes no more than 20 minutes. Once we have that information to hand, we then go out and attend the site of the donation, so be that a hospital, a hospice or a funeral director, where we go about and use specialised equipment to remove the whole eyes for transplantation. Once we actually do remove the whole eyes, there's no cutting of skin, there's no bleeding that occurs, so we reconstruct the appearance of the donor completely, so it's as if we've never attended, and the full dignity of the donor and their families are upkept at all times. So back at the eye bank, we take the eyes into our specialised clean lab facility. These are specialised labs which are virtually particle-free. What we do there is we remove the two corneas off both eyes and we store them in a special media for transplantation. The whites of the eye, the sclera, we can actually split into 4 parts per eye from selected donors, providing us 8 pieces of sclera. This then allows us to actually provide 10 pieces of tissue from an eye donation, being 2 corneas as well as the 8 pieces of sclera. The retina that's left over, unfortunately, we cannot use for transplantation. However, if we have consent from the family for research activities, we can pass it on to the Institute of Ophthalmology for their research work. So the donated tissues can actually be used to give the gift of sight to people who, through no fault of their own, through disease or injury, have low vision or lost their sight. Here at Moorfields Eye Hospital, we provide these tissues to over 1,000 patients per year. And the more tissues we have, the more patients that can benefit. And these patients can be young babies who, again, have low vision due to afflictions with their corneas, for example, who, by providing these tissues, we can allow sight and allow them to develop and grow as a normal person would. For patients who are, say, in their 30s or 40s, by providing a cornea to these patients, you allow them the ability to drive a car, to go to work in the morning using public transport, do things that we would ordinarily take for granted. And for the elderly, it's what we all want in life. It's an independent life, and sight-saving tissues can provide that for some elderly patients, giving them the ability to have that independent life so they can carry on about their way. So human tissue for ocular surgery is essential because it helps people from all walks of life. So the best way to do this is to sign up to the organ donor register, and if you follow the link below, that will take you to the eye bank page on the Moorfields Eye Hospital website. On the organ donor register, just specify which organs and tissues you wish to donate, and that will then stay on that register. Most importantly, though, is make sure you speak to your loved ones to let them know of your wishes to donate your corneas, your tissues, your organs, and that way those decisions will be much easier made at the unfortunate time someone does pass away.